So one of the biggest challenges in the healthcare industry right now is recruiting and retention, especially in the front line with nurses. And really this stems from a post-COVID world in which you had really high pay rates and a lot of help from the federal government. That COVID help has gone away, pay rates have gone down, and patient-nurse ratios have gone up. It increases stress, increases workload for the nurses, and that causes burnout and turnover. And that's really I'd say the number one issue facing healthcare institutions today. I've been in the staffing industry for a long time, and whether you're talking about nurses or you're talking about really any discipline, employee performance and happiness is all about engagement. And engagement is all about understanding what your job is and having the tools and the ability to do your job right. And when nurses are overworked, like when they have 12 patients to one nurse, they don't have the tools to do their job right. They have this, usually a heart for taking care of patients. And when they can't do it, it's very stressful for them. And it leads to really negative outcomes. It leads to people dying. This is a big problem, and nurses are right on the front lines. They're the ones that are taking care of patients. They're the ones that are implementing the doctor's wishes. And when they can't do their job right, there's catastrophic outcomes, and that creates stress and burnout. Nurses say, well, I'm not on my watch. I don't want people dying on my watch. I can't do my job. This is serious. We have a specific example of a young man, 36 years old, and he was being over-medicated. The bottom line is because the nursing staff was overworked, they didn't notice his heart rate drop, and they didn't notice for 20 minutes, and that was fatal. So if they had been properly staffed and had proper ratios, they would have noticed that, and they could have revived him quicker and found the problem. But he had too much. Basically, it was a fentanyl overdose. But fentanyl's been used in hospitals successfully for years, but it's a very small doses, and so he was overdosed, and they would have caught it in time had they been able to monitor his heart rate and catch it. But instead, 20 minutes passed, and he passed away at 36, leaving behind a wife and two kids. They came in for a routine procedure. Shouldn't happen. I think it's really important for hospitals for healthcare institutions to partner with someone that can help them deal with their staffing shortages and burnout. And part of that is, of course, working on their environment, working on their ratios. And part of how you deal with those, one of the most effective ways you deal with lowering those nurse-patient ratios is you make sure you have proper coverage. And sometimes that means last minute, your census goes up and you need nurses to cover a shift tomorrow. And that's where our PRN services come in. We have nurses that are ready to go, that are credentialed, pre-screened, ready to go, and we can send them out to our hospital, our partners, our clients on a moment's notice. Also, we do long-term contracts, which kind of helps, to shore up when they have just an overall long-term shortage, help our clients fill those gaps. They're super busy doing their job, running a hospital, running a nursing home. It's hard to make recruiting your core competency when you're trying to take care of patients and you're short-staffed and you're overworked already. So this is what we do every day, all day. All we do is recruit and credential nurses and CNAs and other allied health professionals. It's really hard for a hospital to do what we do. There are some, on the one hand, filling roles is all based on credentials and experience. Do they have the credentials to do the job? But at a higher level, it's also about putting the right nurse in the right role. And so, of course, we have testing and screening, and we check all their credentials to make sure that they know what they're doing before they go into that role. But more than that, I think it's important to sit down with your staffing partner, and so they can understand what your needs are, what your culture is, and what your census is today, what your plans are for tomorrow. Are you opening up some new hospital beds? Are you expanding? What's the trend in your community? And so that we can help and plan and design a program that makes the most sense for our client, whether it's strictly a PRN last minute covering shifts, or whether it's a combination of PRN and some long-term contracts. It's up to each individual client what their needs are. We encourage our clients to sit down with us and tell us what their needs are across whether it's one or multiple locations, so that we can provide the best solution. What's the one most important thing that healthcare leaders can do to turn the dial right now? And I think it's really very simple, and that is you've got to empower the nurses on the front line to do their very best work by making sure that those patient-nurse ratios are reasonable. In fact, there's only 2 states in the country, Massachusetts and California, that even have regulations governing the nurse-patient ratio. So it's an important issue, and regulations don't speak to it. So it's up to the individual hospitals to come up with a good plan. And that's really key to retention, to good patient outcomes. It's key to everything.